Hi, my name is Jessica Hunter, and this is the video project for Module 5. Today we are going to be discussing the anatomy of the eye. The eye consists of the conjunctiva, ciliary body, the iris, the lens, the pupil, the cornea, the sclera, the optic disc, the optic nerve, the macula, the retina, the choroid, the vitreous body, and the anterior chamber. The first common disease that we are going to be discussing is conjunctiva. That occurs in this area right here. Conjunctiva is an inflammation or infection of the transparent membrane that lines your eye and covers the white part of your eyeball. Small blood vessels in the conjunctiva become inflamed, and this makes them more visible. This causes the white of your eyes to appear more reddish or pink eye. The common name for this is pink eye. Clinical manifestations for this disease include redness in one or both eyes, itchiness in one or both eyes, a gritty feeling in the eyes, discharge, tearing of the eyes. Conjunctiva can either be viral or bacteria. Most cases of this is caused by a virus. Both bacterial and viral can occur during cold or symptoms of respiratory infection, such as a sore throat, wearing contact lenses that aren't clean or properly in a case can cause bacterial conjunctiva. Both viral and bacteria are very contagious. They are spread through direct or indirect contact with liquids that drain from the eye. Someone who is infected can affect somebody else. Patient teachings include to wash hands and be careful of spreading this infection due to the drainage. Do not wear contacts until the infection is gone, and throw away the contacts that were worn during the infection. Treatment is usually focused on symptoms. The doctor may recommend using a over-the-counter artificial tear that will clean your eyelid, or applying a wet cloth or cold or warm compression several times a day. The second common disease of the eye is cataracts, which affects the lens of the eye. Cataracts are the clouding of the normal clear lens of your eye. People who have cataracts usually see cloudy. It's like looking through a frosty or foggy window. Clouded vision caused by cataracts can make it more difficult to read, drive a car, or see expressions on faces. Most cataracts develop slowly and don't disturb your eyesight early on, but with time, cataracts will eventually interfere with vision, especially driving at night. In the early stages of cataracts, stronger lighting and eyeglasses can help deal with the cataract. But if impaired vision interferes with your usual activities, cataract surgery may be an option. Cataract surgery is generally safe and an effective procedure. Cataracts is when the lens Cataracts will form behind the lens of the eye. The lens focuses the light that passes in your eye and producing clear and sharp image on that. The light-sensitive membrane in the eye functions like a film. As you age, this lens can become less flexible, less transparent, and thicker. Other cases of cataracts are usually age-related and include other medical conditions that causes the tissue of the lens to break down and clump together, clouding small areas within the lens. Patients may complain of blurred, dim vision. It will become increasingly hard to see, drive at night, and there might be light sensitivity. As the cataract continues to develop, the clouding becomes denser and it involves a bigger part of the lens. A cataract scatters and blocks the light as it passes through, preventing a sharply defined image from reaching your retina. cataracts can affect the center of your lens. This is called a nuclear cataract. Cataracts that affect the edges of the lens are called a cortical cataract. And then cataracts that affect the back of the lens are called a posterior subscapular cataract. Then cataracts that a child is born with is called congenital cataracts. Diagnostic testing includes a visual acuity, which is an eye chart that measures how well you can read a series of letters. The next exam will be a still lamp exam. The still lamp exam allows your eye to see the structures of the front of your eye under magnification. The retinal exam is when the doctor will put eye drops in your eye that will open or widen the pupils. This includes dilation. Treatment typically for cataracts is surgery. Usually with surgery, there will be some discomfort for a few days, but healing will occur within 8 weeks. If cataract surgery is needed in both eyes, the doctor will schedule one eye and wait until it is completely healed and then perform it for the second eye. The third common disease is glaucoma. This is a group of eye conditions that damages the optic nerve. This part of the eye right here. The damage is often caused by an abnormally high pressure in the eye. It can occur at any age. The effects of glaucoma are gradual, and a person may not notice changes in the vision until the condition has advanced. Open-angle glaucoma causes patchy blind spots in the side of the eye, central vision, and it can also happen in both eyes. This will cause tunnel vision in advanced stages. Acute angle closure glaucoma can cause severe headaches, eye pain, blurred vision, nausea and vomiting, halos, and redness. If this is left untreated, it will eventually lead to blindness. Normal tension glaucoma happens when your optic nerve becomes damaged even though your eye pressure is within normal ranges. Glaucoma in children happens when the optic nerve may be damaged by drainage or blocking due to an underlying medical condition. Pigmentary glaucoma is a pigment granules from your iris build up in the drainage canals, slowly or blocking the fluid exiting your eye. Testing for glaucoma includes measuring the intraocular pressure. The physician or doctor will test the optic nerve for damage by dilating the eye during an exam and image testing. The doctor will also check for areas of vision loss, measuring the corneal thickness, and inspecting the draining angles. Glaucoma is treated by lowering your eye pressure. Depending on your situation, your option may include prescription eye drops, oral medications, laser treatment, surgery, or a combination of any of these. Some of the medications include prostaglandin, which increases the outflow of fluid in your eye, and beta blockers that reduce the production of fluid in your eye. Types of surgery might be filtering. This is when a surgeon creates an opening at the white of the eye, the sclera, and removes part of the tubular meshwork. Drainage tubes may be inserted into the eye. It will be a small tube shunt that would drain away excess fluid to lower the pressure. The doctor may also recommend minimally invasive glaucoma surgery to lower the eye pressure. Patient education for glaucoma would be teaching the patient about the upcoming trials and how to deal with the chronic illness. Teaching may include support groups and healthy coping mechanisms. Thank you for watching, and that is my video on eye anatomy and 3 common diseases that can happen with the eye. Thank you.